to the Studio DOHC podcast. My name is Valerie Madaffari, and I am the Associate Director of the Cardiology Clinic. And I am here with Victoria Landry, who is a nurse practitioner in the primary care clinic. Today, we want to have a conversation about nurse practitioners, their roles, and the importance of it. Recently, we celebrated Nurse Practitioner Week, and the theme was recognizing heroes in healthcare. So, in the state of California, nurse practitioners can practice autonomously. We have full authority practice, which means we do not have to have a collaborating physician to work under. We also, nurse practitioners can prescribe scheduled medications, including narcotics and anti-anxiety medications. So I wanted to pass it on to Victoria to find out her journey in becoming a nurse practitioner.
Well, thank you for having me. I'm very happy to be here today to talk about nurse practitioners.
Oh, you're welcome.
So my journey started out, I went to nursing school. I actually was in a hospital-based nursing program a long time ago. And after I graduated, my very first job was working up on a Northern Reserve in Canada. And that's where I first experienced nurse practitioners and what they do. They've long been used in Northern Canada, in remote communities, Inuit and Native communities. And the nurse practitioners there basically operated like physicians. And I was fascinated by the role. So I decided I was going to go back and get first my bachelor's degree and then work towards the nurse practitioner role. So I did a master's, and then at the time that I had finished my master's, knowing that I wanted to become a nurse practitioner, there was talk about the fact that a new terminal degree for nurse practitioners called the Doctorate of Nursing Practice was going to eventually become the entry to practice. And I had also at that time decided that teaching was something I was going to be very interested in. So I decided to pursue that as the terminal degree that I would go after. And when I graduated, I'm very happy to say that I'm working in a wonderful, fulfilling role as a nurse practitioner and also teaching part-time as well. Mm. And what about you, Valerie? What was your journey?
So I started out in a BSN program. So I started with my bachelor's degree. And I worked for 5 years and just was not fulfilled. I wanted to do more. I wanted to actually see a patient independently, make the diagnosis, order all the tests, or, prescribe all the medications. So I, like you, went back to school, got my master's degree in nursing. My track was a family nurse practitioner. So for nurse practitioners, there's different tracks. You can be a family nurse practitioner, an adult nurse practitioner, pediatric, gerontology, and acute care nurse practitioner. So I got the family nurse certification. And I also knew that we needed a terminal degree and had that doctorate in nursing practice. Mm-hmm. So my school actually sent me an email saying that they were going to start a DNP program. So I was like, okay, let me go to this informational meeting. And if I get accepted, this was meant to be. And I got accepted, and I graduated in the 2 years with the doctorate. And I am so much happier that I have this kind of doctorate degree. And something that you said reminded me of when I was in my undergrad nursing program in our health center on campus. The nurse practitioners worked there, and they saw us. There was not a doctor on call. Mm-hmm. And that really excited me about, wow, nurses can do anything, and just there's so many opportunities for nurses. So you have to start as a nurse,
yes,
and then move your way up.
Most importantly, yes.
So you're certified in what kind?
So I'm an adult nurse practitioner in the United States. In Canada, I was a family nurse practitioner. Mm-hmm. Most of the patients that we see in primary care are certainly adult, mm-hmm. but as an adult nurse practitioner, I can see basically from 12 years old and up. Mm-hmm. I saw babies in Canada, and that was something I decided I didn't need to do for the rest of my my career. So very happy to see adults and children who can tell me what's wrong with them.
Oh, okay. Yes, and then I specialized in cardiology because I didn't want to do primary care. I didn't want to be seeing patients every 15 minutes. What did help me in my nurse practitioner program was working in the ER, because you saw everything in the ER. So when I did my rotations, it didn't bother me seeing the pediatrics. But remember, your pediatric rotation, you were sick every day because the kids were always sick.
Right. Yes.
So here I also see cardiology patients, and that's all I see is the cardiac patients.
Mm-hmm.
And it's a big world. There's also subspecialties in cardiology too. You can do electrophysiology and just deal with pacemakers and defibrillators, or you can do follow-ups for the angiograms. So checking the patients after they've had a heart attack,
Mm-hmm.
after they had stents or bypass surgery, or predominantly here at Desert Oasis, we have a lot of heart failure patients, and they are the sickest of the sick.
Yes.
And it's very challenging, but it's very rewarding to see them get better.
Mm-hmm. In primary care, I think one of the things that's interesting to me are those longitudinal relationships that you have with patients. You sort of know a little bit about a lot of things, but you're not necessarily, as you are, specialized in a particular area. So you do see a lot of variety. You do get to know a little bit about everything, as I say. And then, it's always interesting when you can expand your practice a little bit to do joint injections, to do treatments for simple skin issues, be it liquid nitrogen or whatever. So it's interesting and great that there's that much variety that we can all sort of choose an area that we're interested in, and it's just very fulfilling.
Yes. So, what is one thing that you would tell a patient about how you practice and the difference between a nurse practitioner and a MD?
So I get that question sometimes in the clinic, and I always try to find a way to sum that up to patients in one or two sentences. And then I always find it's much more difficult than that. So I think the role between the nurse practitioner and physician, there's a lot of crossover and a lot of similarity, certainly. But I think one of the biggest differences is, and I respect all of my physician colleagues, but they really approach more of a disease state in the patient. They want to make patients well. And I think the advantage of coming with a background of nursing, I really do think you have more of a holistic view of patients, and you're really looking, we were always taught that with assessment, it's a family assessment, it's a social economic assessment. Mm. So you come with that background knowledge to really make sure that you're providing holistic care to patients. And I do also, as a nurse practitioner, I do have the luxury of a little bit longer patients with, or a little bit longer time with patients in their appointments. Mm. So there's a lot of crossover. We do a lot of similar work. We come at our education from different aspects, and I hope that the way we care for patients is more of a symbiotic relationship versus this is what the physician can do for you versus this is what the nurse practitioner can do for you.
Yes, because we work
I hope that answers the questions. Yes.
And I'm remembering when we were in school, we used the nursing model, and doctors use the medical model. Right. So it's just a different way to learn.
Yes.
And like you said, we look at it holistically more.
Yes.
Because everything is involved.
That's right.
Is there anything else you want to tell us about being a nurse practitioner?
I just think it's very rewarding. Again, getting to know your patients over the long term. That's one of the biggest things I love about primary care. Seeing them through very happy times with their health, seeing them through difficult times with their health, and just being able to be part of a healthcare team that can positively impact the lives of patients, I think is just very rewarding. And I'm proud to be a nurse. Mm. Sometimes patients will say, well, are you going to go on to become a medical doctor, or, somehow did you fall short of not becoming a medical doctor? And no, I'm a nurse. I started out as a nurse. I'm a nurse now. I'll always be a nurse. But the role of nurse practitioner allows me to participate in patients' healthcare to the fullest degree.
Yes. And I will say here at Desert Oasis, the nurse practitioners practice to the highest of their degree, Absolutely. Which is very nice. So we have our medical director, Dr. Mark Hoffing, who really supports the nurse practitioners that work supportive. At Desert Oasis. We hope you learned more about nurse practitioners and what they can do, and hope that it makes you feel more comfortable seeing a nurse practitioner in your healthcare journey. To stay up to date with our podcast, please subscribe, hit the bell, and give us a like. And for more on us and what we do, visit mydohc.com. Until next time.